This video abstract for the journal Academic Medicine will tell you more about the research report called Analysis of Mood and Anxiety Disorder Content in Common U.S. Obstetrics and Gynecology Resident Educational Resources by Claire Lennon, an OBGYN resident at the University of Rochester Medical Center, and Marika Toscano, a maternal fetal medicine specialist at Johns Hopkins University. Did you know that mood and anxiety disorders are among the most common complications of pregnancy, affecting up to 20% of pregnant individuals? These conditions can have lasting impacts on both parent and child. Yet many obstetrics and gynecology residents may not receive adequate training to address these critical issues. Our study focuses on a pressing question: how well do educational resources for OBGYN residents represent mood and anxiety disorders? We analyzed widely used third-party educational materials such as textbooks, professional society guidelines, online question banks, and others. Our goal was to evaluate whether these resources provide comprehensive coverage of mood and anxiety disorders in order to better delineate potentially deficient topic areas for targeted improvement in future OBGYN resident educational curriculum initiatives, and with the ultimate goal of better preparing OBGYN clinicians to address the mental health needs of their patients in post-residency practice. Here's what we found. From over 3,000 items reviewed from across all the resources, we identified 36 relevant entries that covered mood and anxiety disorders. Depression was the most covered topic, found in over 80% of sources. Anxiety appeared in about 1/3, and bipolar disorder in about 1/4. PTSD, OCD, and schizophrenia received minimal coverage. Treatment principles like pharmacotherapy were well represented, but content was imbalanced. SSRIs were overrepresented in test questions, and medications that have known teratogenic risks like lithium and valproic acid were mentioned sparingly. And topics like lactation safety of psychiatric medications were rarely covered. Additionally, discussions about cultural and systemic barriers to mental health care were almost entirely absent, and none of the resources discussed collaborative care models, which are critical for managing complex cases. This lack of comprehensive mental health educational resources has real-world consequences, as OBGYNs are often the first point of contact with pregnant individuals that experience mental health challenges. Our study highlights the need for enhanced educational resources in OBGYN training for mental health conditions. By incorporating more detailed content on mood and anxiety disorders, including evidence-based screening tools and treatment strategies, we can better equip future OBGYNs to provide holistic health care. Take a look at our article for more info.
Created using Powtoon.